Autism diagnoses prove highly stable as early as 14 months. The primary article that I looked at for this week was evaluation of the diagnostic stability of the early autism spectrum disorder phenotype in the general population starting at 12 months. Autism spectrum disorder is a common disorder in childhood and affects about 1 in 59 children. Currently, it is known that the disorder has its beginnings in prenatal life as children within their first year of life start to show clinical signs such as reduced positive affect and failure to respond to their name. Because of this, universal early screening for ASD in primary care is becoming increasingly common and is believed to be a pivotal step towards early treatment. While previous research has shown that signs of ASD can be detected using parent report screens from as early as 12 to 18 months, the average age of ASD detection is between 3 and 4 years old. The lag in detection causes the patient to miss out on an effective therapy that could be given during the accelerated brain developmental stage that occurs between birth and 3 or 4 years old. The purpose of this experiment was to examine the diagnostic stability of ASD in a large cohort of toddlers starting at 12 months of age and to compare this stability with that of other toddlers with other disorders, such as developmental delay. The study looked at 1,269 toddlers that were referred for a diagnostic evaluation at an autism expert evaluation center. The toddlers underwent diagnostic and psychometric tests. The subjects that received their first evaluation younger than 36 months were diagnostically tested every 12 months until 3 years of age. They could have been designated as having ASD, ASD features, developmental delay, or language delay. Parents were given feedback and referred for treatment if needed. For results, diagnostic stability of ASD within the youngest age band from 12 to 13 months was the lowest, but greatly increased by 14 months and slightly again after that by 16 months. Therefore, the results found that within the context of an early detection program, children can be reliably diagnosed with ASD several years earlier than the average, even as young as 14 months. The authors say that the next step is to understand which treatment would be most effective for children with such early detection. The secondary article that I looked at was called Autism Diagnoses Prove Highly Stable as Early as 14 Months. The article gave sufficient background information and accurately portrayed the methods and results of the primary article. It also included helpful quotes from the author of the primary article, which made the purpose of the experiment even more relative. Finally, the article was definitely geared towards someone with a background in science, which is probably to be expected from an article from neurosciencenews.com, which is why I would give the secondary source 4.5 stars.